Good afternoon. My name is Jenny Vargas, and my community intervention project is on adolescent sports-related concussion. The adolescent age is typically noted to be from 13 years old to 19 years old. The World Health Organization actually identifies adolescence as a period in human growth and development that occurs after childhood and before adulthood, and they name this span from ages 10 to 19. It does represent one of the critical transitions in the lifespan and is characterized by a tremendous pace in growth and change that is second only to that of infancy. The biological processes drive many aspects of this growth and development, with the onset of puberty marking the passage from childhood to adolescence. According to Erik Erikson, this is the period where a person transitions from childhood to adulthood and may begin to experiment with different lifestyles to find one's identity or role they will occupy as an adult. This process of defining oneself can lead to risk-taking behavior and a desire to fit in with different groups. This risk-taking behavior is actually what leads me to the problem to address with this community. The leading causes of death for this age group are in order on the slide. They are unintentional injury, homicide, suicide, cancer, and then heart disease. In this community, unintentional injuries are the leading cause of death. These can be motor vehicle accidents, falls, drownings, head injuries, etc. Over 80% of adolescent deaths are actually caused by unintentional injury. 15 to 24-year-olds are actually the second largest reported group with fatal traumatic head injuries, secondary to 65 and plus. The costs of prevention are far less than the cost of a lifetime treatment. Total lifetime cost for treating a single non-fatal unintentional injury was $25 million in the year 2000. Now, every traumatic brain injury, direct and indirect costs, total approximately $60 billion, not to mention the emotional burden and toll that a traumatic brain injury takes on the patient and the family. So that brings me to the message. The former Surgeon General, Dr. Koop, stated, "If a disease were killing our children in the proportions that injuries are, people would be outraged and demand that this killer be stopped." My task with this community was to create an injury prevention program that focused on concussion prevention in the adolescent age group. Target audience to affect change would be those that support this community and the community itself. The following couple of slides are a presentation that is adaptable to all audiences, with the version I'm presenting being targeted to a healthcare provider that might treat this community. The healthcare provider presentation, entitled Advances in Concussion Management, can be tailored to fit any audience. It can be tailored to fit coaches, teachers, parents, the adolescent, or the community alike. Each year in United States emergency departments, they treat an estimated 174,000 sports and recreation-related traumatic brain injuries, which would include concussions, among children and adolescents from birth to 19 years. This is actually an increase of 95,000 from the prior year. So out of the list listed there, which sport do you believe ranks the highest? Is it cycling, basketball, soccer, winter sports? It's actually cycling, with almost twice as many injuries as football. And if you'll look at that list, they were actually in order. Football actually gets the most attention in the media. However, rates are just as high with girls' soccer. Studies estimate that more than 62,000 concussions are sustained each year, specifically in high school contact sports. So my question is, the 95,000 increase that we saw from the year prior, is that because there's actually an increase in events or an increase in awareness? Let's take a look at the following video that will show some cause and effect of concussions in adolescents.
Ooh! God, don't tell me that was suicide.
A scary looking sight on the ice at the Bell Center.
Chris Patch already trying to reach for a puck. Giancarlo leans on him and he just takes it right in his head. A lot of force moving to a stand.
15-year-old Audrey Ray and her 13-year-old sister Bridget are among the hundreds of thousands of girls each spring and summer who play girls lacrosse. A game of speed, grace, and finesse. A game that is supposed to be non-contact.
What the sport is advertised to be is very different from what the sport is actually. We're playing more aggressively, we're starting to push more. You just assume that you're safe, but I guess that's kind of different.
It just didn't occur to me, I guess, that kids would be whacking each other on the head.
Audrey and Bridget are sidelined now after each suffered serious concussions from hits to the head while playing for their school teams in Pittsburgh. Bridget was struck by an opponent's stick in April.
She shot, and her stick followed through and hit my head. And well, when you shoot, you have the most power, so it obviously did a lot of damage.
Bridget missed 2 months of school. She spent her days alone in her quiet, darkened bedroom, avoiding the lights and noise that make her dizzy and cause debilitating headaches.
Some days it's really bad, like yesterday was awful. But I just keep trying to go on.
Audrey missed a month of school, and her brain took 5 months to recover after getting hit in the head last year with a lacrosse stick. She was finally cleared to play this spring, but during a game, she suffered another concussion and missed the rest of the season.
I had to sit out for about 7 games, and I had to miss our last game, which was really rough. I wanted to play.
Come on, Bridget.
Bridget and Audrey have made more than 100 visits to doctors and therapists. Bridget has endured 4 months of physical therapy to help retrain her concussed brain.
Hair out of your eyes, you can see.
When doctors ask for the date of her injury, she flashes her hospital wristband because her memory often fails her.
It's hard for me just to remember my day a lot of the time. I have to stay on my medication to help my head get better. I don't really like living like this. It's not fun.
The conference on concussion in sport was held in Zurich in November of 2012. Here, the greatest minds in concussions and neurology gathered to create the consensus statement on concussion in sport. They set forth this new definition stating that concussion is a brain injury and is defined by a complex pathological process that affects the brain, is induced by biomechanical forces. Several common features that incorporate clinical, pathological, and biomechanical injury constructs may be utilized in defining the nature of a concussive head injury. They include that a concussion may be caused by either a direct blow to the head, face, neck, or elsewhere on the body with an impulsive force that's transmitted to the head. Concussion typically results in the rapid onset of short-lived impairment of neurological function that does resolve spontaneously. However, in some cases, they note that symptoms and signs may evolve over a number of minutes to a number of hours. Concussions may result in neuropathological changes, but the acute clinical symptoms largely affect a functional disturbance rather than a structural injury, and as such, no abnormalities are typically seen on standard structural neuroimaging studies, such as CTs and MRIs. Concussion results in a graded set of clinical symptoms that may or may not involve loss of consciousness. Resolution of the clinical and cognitive symptoms typically follow a very sequential course. However, it is important to note that some cases, symptoms may be prolonged. So this slide is actually going to show you some signs and symptoms that are related to concussions. Unfortunately, folks don't always recognize that the symptoms that they're having are related to the concussion that they sustained. For example, I had an officer, an Air Force officer that I was speaking with, and he was telling me he had been in a cycling accident where he was hit by a vehicle. He said that he went to the emergency room, that they did complete CAT scans pretty much on every part of his body. But he stated he was still having difficulty sleeping, that he was kind of sluggish, forgetting where he was leaving things, such as his keys. He stated that he was feeling nauseated all the time and was quite concerned that he had maybe damaged something internally that they hadn't caught. The ER physician did diagnose him with a concussion, and what he wasn't realizing was that all these signs and symptoms that he was having were actually related back to that concussion and just not giving his brain time to heal after receiving the impact by the car. So there are some metabolic changes that happen in the brain when you sustain a concussion. There are alterations in internal and external glutamate, potassium, and calcium, which flood in and out of the neurons. There is a decrease in cerebral blood flow, and this mismatch in supply and demand results in a cell dysfunction and increased vulnerability to second insult. Evidence is showing that this mismatch is more prominent and fatal in adolescent populations. The next video I'm going to show you is actually Dr. Mickey Collins, who is one of the leading physicians in this area, and he's going to explain this mismatch in supply and demand.
If you have a blow to the head that's sufficient enough to cause the brain to move inside the skull, a certain neurochemical called potassium is released outside of the neuron. At the same time, a second neurochemical, calcium, which is supposed to be outside the cell, it leaks into the neuron. And for some reason, a second blow during this period of metabolic crisis will set off a cascade of events that you can't turn back from. And that's when you see the massive brain swelling. I don't believe the second event would have ended up resulting in a catastrophic outcome if it weren't for the first concussion occurring.
Next, I want to speak of some of the complications from concussions. Post-concussive syndrome symptoms are actually listed there. They break down into 3 different groups. You'll see there's physical, cognitive, and emotional behavioral changes. For many, these symptoms last 3 to 6 months or sometimes longer, which is when it becomes the post-concussive syndrome. The symptoms may occur immediately, or they could even appear spontaneously weeks or months after the injury. Second impact syndrome is what we've been hearing most about in the media. This involves an athlete suffering post-concussive symptoms following a head injury that is returned to play too soon with the subsequent second head injury. It actually was first coined in 1984 and described even previous to that in 1973. It results in edema, swelling, herniation, and/or death. It's a very rare condition, and it's not well documented in the literature. However, there is more research occurring around this syndrome coming out of Boston University. It is limited to teenagers or adolescents. There are no reported cases in the NFL, NHL, or MLB. And really, it only takes a minor blow to the head or hit to the chest or even the back that snaps the head enough to have the brain rebound inside the skull. Because the brain is more vulnerable and susceptible to injury after the initial head injury, it only takes a minimal force to cause this irreversible damage. This next video is actually going to speak of Nathan Stiles, the Spring Hill football player that passed away in October of 2011. This is an emotional video, so if you need to skip forward, please do.
How do we best protect kids from head injuries, especially head injuries related to sports? Scientists are making incredible headway trying to link these hits on football fields, for example, with mood swings, with depression, with even suicide, something that we've talked about quite a bit. There is a signature injury, and we're starting to see it in people younger and younger. But here's the problem. We don't know exactly how common this injury is, because as things stand now, it can only be diagnosed after death.
Chronic traumatic encephalopathy, CTE. It's a progressive disease.
It spreads throughout the nervous system with aging, and I think we're starting to be able to match up clinical symptoms with the amount of spread in the brain.
Dr. Ann McKee has made it her life's mission to understand why some players are susceptible to CTE and others are not. She's a director of the VA CSTE Brain Bank. It's a joint project between the Veterans Administration and Boston University.
When you think about Alzheimer's, you think about characteristic changes. You're starting to see some of those same types of changes in people that are younger as a result of
repetitive trauma to the brain. It's not the same distribution, and it doesn't affect the same parts of the brain, but we do see some characteristic shrinkage.
But what we're seeing here, is this definitely caused by blows to the head?
It's never been seen in any reported case, except in a case of repeated blows to the head.
I think the remarkable thing to a lot of people is how early in life some of these changes can start to take place. What's the youngest that you've seen some of these early signs of what people are calling CTE or sort of a dementia-like thing?
The youngest case to date is a 17-year-old.
The brain of Nathan Stiles.
Which is Nathan Stiles, right.
For Nathan Stiles, 2010 was supposed to be his year. The 17-year-old senior from Spring Hill, Kansas, was the star running back for his high school football team. He was also a starter on the varsity basketball team.
If you would watch him run, he had a flow about him that was just beautiful. I mean, it looked so graceful.
He was an athlete, but school was more important. His grades and a future and a family, and he just has priorities right.
On Friday, October 1st, 2010.
The 2010 homecoming king is Nathan Stiles.
The Spring Hill Broncos lost that game.
The next day he told me he had a headache, and I said, well, really? He said, oh yeah, I think I just got knocked around. I'm like, okay, well. And I got a call that following Wednesday, from the trainer at school saying, Nathan's telling me he's still having headaches. You need to go take him to the emergency room. So I did. Had a CAT scan, nothing.
Despite a clean CT scan, the doctor kept Nathan out of play for 3 weeks.
I remember him looking at me and he goes, Mom, are you okay with this? And I'm like, well, no, but it's his choice. You know, it's his choice. Nathan, you want to play? Yeah, I'm all right. Yeah, I only got, 2 games left. I'm going to play. So he did.
He took a hit that next game, but he seemed to be fine. Nathan played the final game of the Broncos season the following week. And just before halftime, as Nathan went to intercept the ball, another hit.
He had collapsed on the sideline, and the coaches were telling me to, try to wake him up, and then I heard him say he's seizuring, and then that was it. They took him in the ambulance. We waited for life flight, and everything went bad from there, from bad to worse.
Nathan's brain hemorrhaged significantly, and his doctors could not save him. Nathan died of second impact syndrome, a condition that occurs when a player is hit again too soon after a concussion. It primarily impacts younger athletes like Nathan.
If there's anything that needs to be learned from this, if there's anything we can do reasonably to keep somebody's family from getting involved in what happened to us, we'd love to help do that.
You know that he was just an amazing young man who just loved the play of sports, and unfortunately had some fairly minor injuries that most likely resulted in his death.
I mean, I have kids as well. I mean, I think the hard part is you hear that relatively minor injuries, healthy kid, and then he dies. Right. And I think that the question for a lot of parents is, what's the message to me?
The message is, take care of your head. Don't play with your head. Play smart, play safe. And if you do get a head injury, even if it's really mild, you take care of that injury.
Since the 1920s, it has been known that the repetitive brain trauma associated with boxing could produce a progressive neurological deterioration, which was initially termed dementia pugilistica. More recently, this has been coined chronic traumatic encephalopathy. Clinically, CTE is associated with memory disturbances, behavioral and personality changes, and speech and gait abnormalities. Pathologically, this also is characterized by atrophy of the cerebral hemispheres. Microscopically, what they're finding is that there's a buildup of tau. Tau is this protein that steadily builds up in brain cells, which shuts them down and ultimately kills them. There is some similarity between Alzheimer's and CTE. This chart will show that. CTE is being researched primarily by Dr. Amy McKee from the Boston University Brain Bank. She was featured in that video earlier with Sanjay. All concussions are serious. Most concussions occur without loss of consciousness. Actually, only 10% of concussions occur with loss of consciousness. Studies have shown that repetitive hits, such as those sustained by soccer players, can lead to cognitive impairment in memory, planning, and visuospatial tasks. Studies being conducted at the Sports Legacy Institute in Boston University are looking at the correlation of the presence of CTE and the rate of suicides in NFL players. NFL players such as Mike Webster, Terry Long, Justin Strzelak, and Andre Waters, and most recently Dave Duerson of the Chicago Bears. Dave Duerson actually left a suicide note with him stating that he wanted his brain donated to research so that they could study why he was having so many difficult problems with depression and suicidal thoughts as he aged. He actually shot himself in the chest instead of the head so that they could do this. Autopsies on these deceased football and boxers' brains show that they are more likely to exhibit neurological symptoms and motor impairments. Cognitive impairment is the most likely to affect attention, memory, executive frontal functions of the brain. Behavioral changes can include disinhibition, irritability, euphoria, impaired insight, paranoia, and violent outbursts. As I mentioned earlier, there is some difference between the adult and the adolescent brain. Children and teenagers are more likely than adults to have diffuse injury and prolonged brain swelling. This could be in part to the fact that the immature brain is approximately 60 times more sensitive to brain injury. Therefore, high school athletes might be expected to have a slower recovery than college-aged or older athletes, and they may be more susceptible to severe neurological deficits should they be re-injured during recovery. So gender does appear to affect outcome, and in our community, what we'll see is that females with mild traumatic brain injury are more likely than males to report sleep disturbances and headaches and are less likely to be in school 1 year after their injury. In the study of individuals who presented to an emergency department after a concussion, they found that females were more likely than males to have post-concussive syndrome at 1, 3, and 6 months after injury. So concussion rates per 1,000 athletes show that a girls' soccer actually has a 60% higher concussion rate than the male counterpart, and that girls' basketball has a 180% higher concussion rate when compared to that of boys' basketball. So is this because girls actually just report better than the male counterparts, or is it because the female brain is actually more susceptible? So in any concussion management program, whether educating coaches, teachers, athletes, students, parents, or the community, the recognition of signs and symptoms is the most important. Emphasizing the key signs and symptoms such as dizziness, balance issues, headache, etc., but also emphasizing that unconsciousness or amnesia are not required for concussions. Studies from hockey players in Utah showed 50% underreporting of concussion signs and symptoms. Many reasons are hypothesized: that the adolescent does not want to let the teen, coach, or parent down, that they may not understand the consequences of continuing to play with a concussion, and even that these signs and symptoms may just not be present yet. Again, like I said earlier, a lot of these signs and symptoms can show up many days or weeks after the accident. In the cognition portion of concussion management, we really need to be looking at neurocognitive exams as opposed to the person, place, and time questions that we used in the past for memory assessment. These neurocognitive exams should be used at baseline prior to any athletic participation, at 48 hours post-injury, and prior to any return to play. There are some sideline tests that can be used as well to help determine whether a concussion has occurred. Most of these, though, need to include some sort of balance testing as a portion of the neurocognitive exam. These neurocognitive tests are just a way to look more specifically at the cognitive brain function. There is actually a paper-based test that was created by the Consensus Group on Concussion in Sports. It's actually now called the SCAT-3. I'll show you an example of this in another slide. There's several different types of computerized testing. The Concussion Resolution Index, Axon Sports created one as well, Headminder. But impact testing is actually the most prominently used neurocognitive test out there. It was actually created by Dr. Mickey Collins out of Pittsburgh. So since impact is most widely used, just go over that one. Impact Post-Concussion Assessment and Cognitive Testing is what that stands for. The test actually measures symptoms, verbal and visual memory, processing speed, reaction time, attention span, working memory, selective and sustained attention time, response variability, and nonverbal problem solving. It takes approximately 20 minutes to complete and can be done by anybody motivated to actually supervise impact testing. However, the test review is preferred to be done by a clinician. There is incredible importance to baseline testing. David Woodley, quarterback for the Steelers in the 1980s, was sacked early in the season and suffered a concussion. He had been out for 2 weeks with concussive symptoms. Back then, he was asked to take an experimental test, which would later be called IMPACT. Woodley scored well in the average range. The Steelers asked him to return to play, but Woodley refused, stating that he still did not feel ready. The following week, he tested on the IMPACT again. This time he was off the charts, way out of the average range. He'd been right the whole time he'd been impaired. However, without a baseline test, we would have never known that he had not been back to par. The SCAT2 can be freely copied for distribution to individuals and actually can be co-branded with your organization's name on the back. When we speak of concussion management, we really need to talk about cognitive rest and what that means. The community, being adolescents, their role is really a student, not an athlete. We are talking about a therapeutic goal of just having a tolerable level of symptom and management of those symptoms. What is cognitive rest? Cognitive rest can mean refraining from activities that include mental exertion, such as working on a computer, watching television, using the cell phone, playing video games, text messaging, etc. Sometimes student athletes can derive benefit from full-time or part-time removal from school while they're symptomatic, but it is all an individualized assessment and needs to be coordinated with the school to have accommodations made for testing, studying, and homework. There is a return to play guideline that was created. The graduated return to play is actually a stepwise approach. Each step occurs over 24 hours. If a athlete becomes symptomatic with progression, you would regress one step back. The final clearance needs to be by a licensed medical personnel. There are modifiers which can affect return to play, such as the severity of the concussion, previous concussions, significant injury in response to a minor blow, age, sport, learning disabilities, etc. This slide actually outlines those steps to a safe return to play. There are modified versions for adolescents who are not involved in sport and sustained concussion that are just steps to a safe return back to study in school. Irregardless of whether or not the adolescent is an athlete or not, it is important to remember that concussion management is about return to learn, not about return to play. It's about keeping these adolescents well so that they can live productive lives beyond the playing field. So this is all about culture change. Kyle Turley, who was an offensive lineman in the NFL from 1998 to 2007, said, "That's just football. You're told either you're hurt or you're injured. There's no middle ground. If you are hurt, you can still play. If you're injured, you can't. And the line is whether you can walk and whether you can put on a helmet and pads." This culture of courage has been built around the ability to play through pain and injury, and it's time to change that. In 1905, President Theodore Roosevelt actually stated that the brutality of the prize ring had invaded college football and could end up destroying it. Back in 1905, the presidents of 12 prominent colleges actually met in New York and came within one vote of abolishing the game. The main objection at that time was the style of play, which was largely corrected with rule changes. So the goal. How do we save our sports? There is a 10-point plan for safer sports that was created by the Sports Legacy Institute. Sports Legacy Institute was actually founded by a former professional wrestler and previous Harvard defensive tackle with the goal in mind just to save our sport and make it safer for the athlete. Now the CDC also came out with a concussion action plan. Really what this action plan gets at is when in doubt, sit them out. Make sure you're taking the athlete out of play if you suspect any kind of an injury. There is a game day action plan with the main goal of assessing, reassessing, and reassessing the patient. You'll see here the map that actually shows the different states in November of 2011 that had existing pending or no legislation in place. You'll see there's just a few states there that had not gotten on board with any kind of concussion legislation. What's cool is you can actually look here at the map from January of this year that shows that all 50 states have some sort of concussion legislation. Mississippi was actually the last to join in January of this year. But you'll notice in this map there's actually different colors, and what that's representing is that there are different sports legislation for each state. Some have more stringent and some less stringent. So data from the National Center for Catastrophic Sports Injury Research showed that from 1989 to 2002, there were 94 cases of head injury in high school and collegiate football. Of those 94 cases, 75 were subdural hematomas, 10 were subdural with diffuse brain swelling, and 5 were diffuse brain swelling, 4 being an AVM or aneurysm. Of those 94 cases, 92 were high school players. Of these 92 high school athletes, 59% of them had a previous history of concussion. 71% of them had injuries that occurred in the same season as a catastrophic injury. And sadly, 39% of these athletes with catastrophic injury were playing with residual concussion symptoms. So herein lies the opportunity to prevent the catastrophic injury. Some evidence-based recommendations for healthcare providers are to educate the patient and the family about post-concussive symptoms and the management, where to seek further help, whether it be from physical therapy, speech therapy, etc., risk of further serious injury with subsequent head trauma, making sure that we recommend stepwise return to play guidelines, and advocating for access to neurocognitive testing. Evidence-based recommendation for parents: when in doubt, sit them out. Making sure that we always have medical clearance before returning an athlete to play, and making sure that if your school does not do parent education, that you insist on it. Some recommendations for our adolescents: making sure to tell them that reporting their symptoms is important. Tell a parent, tell a coach, tell a friend. Being out for a couple of games is definitely better than missing the whole season or even more than that. Making sure that we prepare our body, strengthening neck muscles to protect the head, and using protective equipment as it's provided, making sure that the protective equipment you have is used appropriately and that it's in good condition. So the next slide is a story of Preston Plevrides, who was a LaSalle University football player. He sustained a concussion while playing football. Preston didn't report symptoms until 4 days after that game, where he was sent to the health center and diagnosed with a concussion. Unfortunately, he was released a few days later, and while playing in a game that following week, he sustained another hard hit that would change his life forever.
And he'll take Briggs back to midfield, and Briggs now returning it over the 40, 45. And there's an injured player down. Boy, I did not like the looks of how I saw him lying there on that field.
Preston lived without a portion of his skull for 5 months. He would spend his 20th birthday in the hospital trying to regain the use of his arms and legs. After 9 months, he began moving around with a walker. In 2007, 2 years after the hit, he was exercising daily and starting to regain his speech. At-home aides and Preston's parents care for him around the clock.
My name is Preston Plevrides.
5 days a week, he sees therapists who help him work toward one of his goals: to speak publicly about the dangers of playing with a concussion.
How important is it for you to have people understand your story and learn from your experience?
Very.
Very important. Yeah.
Because I don't want people to end up like me.
This is a young man that's been through a heck of a lot.
It's now February 2010, and all eyes are on Preston Plevrides. A concussion awareness event at a New Jersey hospital. In the audience, high school trainers, coaches, his therapists, and family listen to his story.
get good?
What was the message in your speech?
That is a conclusion of the presentation created for the healthcare provider as they try to care for these adolescents. There are a variety of free publications that are available from the organizations listed on this slide. Some examples will be shown on the next few slides. This presentation was actually created for the University of Kansas Hospital in 2011 by myself. However, it's used mainly by the Center for Concussions over at KU now. The CDC actually has the largest selection of publications, free publications for handout and reproduction, and they're pretty good as they do give permission to co-brand the material with your organization's name. The Brain Injury Foundation has materials available for purchase, and then locally, Headstrong for Jake is actually an organization that conducts local events for helmet fittings and free or for donation helmets. I think they charge $10 each for those helmet donations. These are just a few examples of the CDC's program Heads Up and some of their free program materials. You'll see there is a fact sheet there for athletes as well as a fact sheet there for school nurses. They have several different versions of this and have it for coaches and parents alike. This slide just shows you a few examples of the fact sheets you can get from the National Federation of High Schools. And this slide shows you a few examples from Safe Kids and the fact sheets that they have, as well as the physical forms that they provide for sports safety clearances. This is a list of some local collaborating agencies. You'll see we have a great mix of agencies that are very active in health promotion and injury prevention. This is definitely not an exhaustive list. Some ones not listed here could include local Elks, Masons, churches, youth groups, school groups, such as student council, Greek fraternities, sororities, etc. These agencies can assist in a variety of ways. Some examples could include providing volunteers for events, providing speakers or guest speakers. Some of these have information repositories, setting up and conducting research studies, such as the University of Kansas, venues for presenting to groups or communities. Some of these can provide conferences, access to high school coaches, athletes, students. The Royal Stadium, for example, provides Kids Day at the K, where you could actually set up a booth talking about the prevention of concussions. There are a few groups on here that provide funding assistance. For example, Safe Kids Kansas and Missouri receives funding for outreach programs that are related to sports injury and can provide sponsorship for different events. A lot of these actually have access to marketing and promotion and can give you an advantage with some of their access that they have. For example, Chiefs alumni, Royals, Mavericks, etc. And even, for example, like Headstrong, you could partner with them for distribution of helmets. There are a wide variety of resources available to the public on concussions in adolescents. All of these listed resources are accessible via the internet. The University of Kansas Hospital actually created the Center for Concussion Management in 2012, and they offer comprehensive services for concussions in all ages. They have access to resources, speakers, outreach programs, and materials to help with concussion prevention and management. The Seattle Sports Concussion Program provides child, adolescent, and adult athletes with evaluation, treatment, and medical clearance to return to sports. Like the University of Kansas Hospital, their program is composed of healthcare providers in rehabilitation medicine, neurological surgery, neuropsychology, sports medicine, and radiology, as well as imaging services. In addition to concussion management, the program provides education on prevention and treatment of concussions to parents, trainers, athletes, athletic directors, and many others. The program actually partnered with the Seattle Eagles to promote concussion prevention. The University of Pittsburgh Medical Center offers a sports medicine concussion program that again is comprehensive, including multiple care providers. The creator of the IMPACT program, Dr. Mickey Collins, actually practices from this facility. They offer a wealth of resources and studies based on concussion in children, adolescents, and adults. The Centers for Disease Control and Prevention has a specific branch that focuses on injury prevention and control. This program has multiple outreach materials, educational items, and can almost be accessed or ordered. Almost everything can be accessed or ordered for free. They will even allow an organization to co-brand materials they supply for improved communication with patients. The Heads Up program is specifically created for concussion and mild traumatic brain injury in all ages. They offer return to academics and return to play materials for physicians, as well as educational materials for athletes, parents, educators, school administration, and medical providers. The Whiskers, which stands for Web-Based Injury Statistics Query and Reporting System, is a part of the CDC, and it's a database that has an interactive ability for data on fatal and non-fatal injury. Boston University has a chronic traumatic encephalopathy program where they research the long-term effects of concussion and the impacts believed to have on the brain. They hold a brain bank that consists of some of the world's most famous deceased athletes, as well as promised donations from many active professional athletes. Boston University's Dr. Amy McKee actually performed the autopsy on Nathan Stiles' brain after he passed in October of 2011. The Sports Legacy Institute offers assistance in education and concussion policy, education, and research. It was founded by Chris Nowinski, a former Harvard football player and WWE wrestler. The Kansas Department of Health and Environment offers injury prevention and disability program. This program supports state programs such as Safe Kids Kansas and provides the injury prevention plan and statistics for the state of Kansas. And then lastly, the RIO database at Nationwide Children's Hospital is in Columbus, Ohio, and this database is internet-based injury surveillance. The software can actually be used by the public. You just have to ask or request for access to it. There's a variety of media outlets in Kansas City that are very open to working with nonprofits or with organizations to promote health and injury prevention. Some examples of ones that could be used for an adolescent concussion program would be the Chiefs Radio Network, Good Sports KC, which is also a local sports show on the radio. Local television, social media is a great one, the Kansas City Star, and different local magazines. Sadly, the more sensationalized and tragic, the more attention that's drawn to the community. After Nathan Stiles' death, there was quite a bit of publicity available for concussion prevention, which is, just a sad fact of the reality of how media operates. There are many venues to present this information. Some local resources are listed here, but is not exhaustive. As word travels that the presentation can be brought to a particular area, demand will increase. Here you'll see a sample budget for outreach education only in the state of Kansas. This is a small budget for a part-time educator, which would likely be an RN and part of an RN's full-time position. As you can see, the majority of the budget would cover someone to deliver this education locally with a minimal amount of presentations scheduled in outlying areas and by local physicians or providers. The budget only covers for 930 miles of travel and 8 nights of overnight stays out of town. As you can see, I set up this budget to actually help spread this word statewide. And so, obviously, if you wanted to do this on a smaller scale, this budget would be quite less. Funding for this project can come from multiple resources and will be determined by the overall organization that sponsors the program. There could be fundraising projects that target this particular project, such as bake sales, car washes, golf tournaments, etc. The overall project director could apply for grants that apply to the topic. Local Safe Kids chapters typically receive funding for sports injury prevention activities. Or the program could even be absorbed into a larger group, such as the Center for Concussion at the University of Kansas Hospital, where the funding could come from the hospital budget. There could be an endowment set up to support the program, specifically from an existing endowment with injury prevention or a head injury focus. So locally, it would be beneficial to have a research partner that could track the number of emergency department visits for head injury as well as tracking those reported to primary care. However, this may be unrealistic because of the sheer size of our Kansas City metro and the costs associated with this tracking. A sample size of a few hospitals willing to participate in tracking might be more tangible. A reduction in the number of injuries would be a desired outcome, as well as an increase in knowledge of concussion and prevention. This could come from post-testing in schools where concussion prevention education took place. And the testing could even include the parents, school administration, coaches, and teachers, as well as the adolescent. There is a high possibility of a pendulum swing. What I mean by that is that a higher number of injuries reported once the education starts because of the increased awareness. And then as the prevention begins to become part of normal daily life, you'll see lower numbers reported. I really feel like there's no concluding event with this information. I feel like for it to be effective, there must be multiple generations educated and trained on how to continue educating once a provider is gone from the community. Concussion prevention must become habit for this community. This is the conclusion of the presentation. I did leave my personal email address where questions can be directed. Thank you.